Hey everybody, Darren with the White Hatter team, and in today's Thinkable Thursday, we're going to be talking to Dr. Christine Hall about everything COVID. So here she is right here. This is Dr. Christine Hall, and she's Canadian, eh? She's an emergency room physician here on Vancouver Island, and she also has a Master of Science in Clinical Epidemiology. And when I first learned that word, I thought, oh, here we got a doctor that studies medicine, but also studies bugs. But that's not in fact true. So let's bring her in the screen and learn a little bit more about her. So there she is right there. Good afternoon, Dr. Hall. How are you?
I'm very well, Darren. How are you?
I can't resist. What's up, Doc? I can't resist. I'm sure. I know you've never heard this. I want to thank you for participating in today's Thinkable Thursday. We have had just a ton of parents sending us questions because of a lot of the dis and misinformation out there about COVID. So I thought, you know what? I know an expert. Let everybody know who you are, what you do, and what this epidemiology and why is this relevant to the topic that we're going to be talking about today, which is COVID.
Sure. I'm an emergency room physician. That's my weekend and evening job. I've been an emerg doc for close to 20 years now. And I trained in Calgary, and I moved here to the island in 2008. So I've been here a long time now. So we deal in emergency medicine with the front line. Obviously, we're kind of the front door for a lot of people to the hospital. Mm-hmm. I have a master's degree in clinical epidemiology, and I can't say statistics either. Clinical epidemiology means the study of a pattern of a disease in a population. I'm not a COVID expert, but I am a physician and have been one for a long time. And I think most of us have the same questions. Before I went into medicine, I worked in nursing for almost 20 years as well. I started when I was 5. I know.
I saw your nursing pictures. They're still burned in my memory right now when I first met you.
So there are lots and lots of questions, I agree, about COVID, and our physicians and our healthcare staff have the same questions. So I'm happy to talk about a few things.
Yeah, and what's your role? Like here on Vancouver Island, you are with VHA, right? So what's your role within VHA? Yeah, you're an ER doc, but do you have another role within VHA as well?
Yeah, thanks for asking. I'm what's called an executive medical director. So that means I'm the dreaded hospital administrator. What I do in that role, I've previously was the medical director for the Jubilee Hospital and then the chief of staff for both the Jubilee and the General. Now I've moved into our executive offices. So we do strategic planning for all of Vancouver Island. My role is around physician engagement and quality and change and a few other things. So I sit on several of the major steering groups, working groups around management of COVID for our hospital system across the island. Mm-hmm. So I get to work with super talented people like our medical officers of health. Those are our public health physicians who guide us through most of this work. And Island Health now has a vice president role that is assigned specifically to what's called pandemic planning. Right. So we have a huge team of people making sure that we are ready, willing, and able to take it on as it arrives.
Right on. So I picked the right person to ask some questions. So why don't we get into those questions now, Doc? So here's my first question. What does the term immunocompromised mean, and why is this important when it comes to COVID and children and adults? And a lot of these questions were forwarded to me by parents and educators, right, who follow us on our social media platforms.
Sure. And just like lots of big compound words, we can break immunocompromised down to immune and compromised. So what it means is that someone's immune system, for whatever reason, and we'll talk a little bit about why that would be, doesn't work perfectly normally. The easiest group to think of is little tiny newborn babies, brand new to the world, their little immune systems, which are perfectly functional, haven't seen any infectious agents ever, viruses, bacteria, or anything. And so they require some exposure to some things in order to ramp up to work perfectly normally. So when a baby is first born, for the first 3 months of their life, certainly, we consider them to be immune challenged. They're not ill, there's nothing wrong with them, but their system hasn't been exposed. And then at the other end of life, for elder folks, their immune systems aren't functioning top-notch anymore because, like everything else, as we age, functions do deteriorate, and they're less able to fight off viruses or bacterial infections. There are other reasons why someone might be immunocompromised, and I think all of us will know someone who has battled cancer, and many people have undergone chemotherapy. And there's no doubt that we can all think about receiving chemotherapy and what that does to your body's defense system. And so that's a real simple example of immunocompromise, the inability to fight perfectly well against infectious agents.
And will a lot of parents know if their child is immunocompromised?
Oh, yeah, great question. Yeah, any child that is immunocompromised in a significant way, parents will be aware of that. A diagnosis will have been made. There are some illnesses with long names that are immunocompromised from a genetic condition, for example. Right. And parents will not be unaware. In other words, you don't have a 5-year-old generally that you weren't aware until something develops, but your day-to-day little one running around or your teen, you would very likely already know.
And why is this important when it comes to COVID?
Yes. So people who have compromised immune systems have a harder time fighting viruses and bacteria. And those of us who are healthy, who might pick up a virus, and let's use the common cold as a great virus example, we can carry the virus, not know it, and then share it with someone who has immunocompromised. And if they became ill, they would become significantly more ill than we would. And so what we're trying to do is protect each other. And for people who are immunocompromised, they rely on us to protect them from spread, because if they do pick up a virus or a bacterial infection, it's much more significant for them.
Thank you very much. Next question I have for you is, what does asymptomatic mean, and why is this important when it comes to COVID? So, we hear this word and a lot of people are going, what does that mean? And then why is this important when it comes to COVID?
Yeah, it's also a great question. So asymptomatic is another one of those kind of odd compound words, and it means absence of symptoms or no symptoms. In other words, the person doesn't feel or display any symptoms that one would consider to be COVID. And the reason that's important is, like some other viral illnesses, we now know that COVID has an asymptomatic, in other words, symptom-free state when people are carrying the virus. And we know that it can be up to 40% if you tested everyone in a population where there was illness. It can be a lot of people who test positive but have no symptoms. A really common example, just to draw a parallel that most people will know of, although most people my age, is
boomers. They call us boomers.
Chickenpox. So chickenpox has a 3-week asymptomatic stage where people are infectious before they develop that itchy, horrible rash, where they're actually carrying the virus and are quite contagious, but they don't know it yet. And so it's another viral example.
Do people who are asymptomatic, do they eventually get sick? Or do they not get sick, right? Like another question that I have.
Yeah, so there's a ton of research being done right now about that exact question. Is it an asymptomatic carrier state? Or, and we do know that some people who in other countries and probably in Canada, who have tested positive for whatever reason they were tested, never developed the illness. At this moment, we don't know why that is, and we haven't defined the population that is that group.
Very interesting. Next question. Is soap and water better than hand sanitizer? Again, a common question that is asked by parents, right? Because, you know, kids are going to school, maybe they're not going to be able to go into the bathroom to wash their hands, so it's sanitization. So what are the thoughts? What is the research on that, Doc?
Well, you can't beat good old soap and water.
Really? So it's better than sanitizer? Like that's kind of weird, to be quite honest, because you would think that these hand sanitizers would kill it way easier than soap and water.
Well, we're very fortunate in coronavirus because it is very susceptible to virtually any cleaning agent. Doesn't have to be fancy, doesn't have to come in a $4 or $10 spray bottle. So good old soap and water is a really effective way to kill coronavirus. And it doesn't have to be super fancy pump soap that foams out. A good old bar of Ivory soap is just as good. So bar soap or liquid soap is super effective. Dish soap works too. So any soap.
Yep.
Hand sanitizer is the time that hand sanitizer is less effective is when people have visibly dirty hands. So you've got mud or dirt or with kids, food on hand. Hand sanitizer is probably a little less effective, but here's the issue. We don't drag around soap and water everywhere we go. And so soap and water at home, regular normal hand washing, perfectly effective, but it's hard to bring that with you. And hand sanitizer is also very effective with COVID, almost equal, truthfully, like literally equal. We use tons of hand san in the hospital. And so it's the best option for when you're in the car or you're out in public or kids at school. They can certainly use soap and water in the washroom. But, you know, having hand san available to people to use is a great way to kill off COVID. There are some exceptions, probably we should talk about that. You want to make sure your hand sanitizer is not based in a bad product like methanol, which is very, very toxic. And little tiny babies should not be cleansed with hand sanitizer.
Good point.
Fragile skin, they suck on their hands all the time.
Yeah. And
we just need to be careful about age groups. And of course, keeping the product safe so no one drinks it or use it by accident. But in general, soap and water, fantastic, great for home use. Hand sanitizer, super portable, readily available.
So on the soap and water question, how long should you wash your hands for? Like what is the recommended amount of time that one should take to make sure you're doing it right?
Yeah, it's a fabulous question. So the first thing to know is soap in any water. Doesn't have to be hot water. You can use lukewarm, you can use cold. You don't have to scald yourself to kill coronavirus. So soap and water. The recommended minimum time is 20 seconds. So how do you know without using a stopwatch, how long is 20 seconds? It's the time it takes to sing happy birthday twice. And
really?
Yeah.
Oh, I'm going to have to try that and test it out.
Sing happy birthday twice. It's about 20 seconds. And the biggest thing to know is we want to wash the palms of our hands, between our fingers. Let me get in the camera. The backs of our hands, our fingertips, and don't forget your thumb. And
looks like you're preparing for surgery there.
What's that?
It looks like you were preparing for surgery there. That's what you kind of see. But it's basically the same thing, right? Like it's not just this. It's doing exactly what you did.
Yeah. And there's tons of videos online. The BC CDC, so British Columbia CDC, Centre for Disease Control, they even have a little animated video to show little ones how to wash their hands.
And so that website, because that's a question I have a little later on, it's one of those recommended, because as you know, a lot of dis and misinformation out there. There's a lot of people trying to monetize this as well. So that's one of those sites that you as a medical professional would suggest to parents to go to.
Absolutely. And it's updated regularly. All of the latest scientific, it's user friendly. And all you do is Google BC CDC.
Gotcha.
And there you are.
Next question I have for you, Doc, is are youth more prone to COVID than older teenagers? Again, lots of discussions in the parent forums that I am going on right now where they're saying, hey, listen, you know, younger kids are more prone to it than the older teens. And then there are people that are saying, no, they're both just as prone. And then there's others saying, no, that, you know, so what is the medical research to date? Because I know it's ever evolving. What is the best information we have now on that question?
Yeah, it's also an evolving field of study. There's a couple of things to know. First of all, that same website, the BC CDC, which is hard to say, currently on that site, it clearly states that children from 0 to 12 have lower risk if they contract COVID than older teens and adults. And
so just to hold you there, lower risk, not no risk.
Exactly.
Okay.
So low risk does not mean no risk. And one of the challenges in understanding what happens in kids is throughout the early parts of the COVID pandemic, our kids stayed at home. They were kept at home smartly and safely by parents. And so there wasn't a huge body of research into the disease pattern in children. Now we know that many countries across the world have kids back in school and back into more normal daily activities. So we're starting to see some work coming out of those population-based studies to see how kids are doing. We know that some kids who contract COVID become very ill. And sadly, there are reported deaths in children at any age. Recently, a 5-year-old was reported to have died. I think it's important for our parents to understand that, you know, we have a very robust Canadian healthcare system. We don't have to pay for access. And some of those deaths may, and I don't know for sure, but you worry that maybe it was a late presentation of a child who was very ill for monetary reasons, can't afford to seek healthcare, but we don't know. So emerging work is being done to really nail this down. You can read that, you can find a study to support any opinion.
Yeah, ain't that the truth?
But currently the BC CDC, which I use as a source of truth, states that the kids 0 to 12 are at lower risk.
So, which kind of segues nicely into my next question, actually, which is, do kids shed the COVID virus as much as adults do? And maybe you can talk about what is shedding, because we hear that a lot being reported, and a lot of people think like a dog or a cat, right? Like, so can you talk a little bit about what shedding is, and then answer the question you best you can based upon the research we have on that specific question?
Yeah, you bet. And we'll talk, I'm sure, in a little bit about how the virus is transmitted. But viral shedding just means that virus particles are found in your saliva or other, most importantly, saliva, and that as we speak or sing or yell at hockey games, that our droplets that come out of our mouth and nose when we cough or sneeze, talk, sing, cheer, groan, when you're in a contact sport, those are what we term viral shedding. There are virus particles detectable in those droplets. So the question is a great one. Do kids shed as much virus as grown-ups do? Kids are smaller. They have smaller lungs and smaller, everything. But that's probably not the predictive thing. the whole world is studying this right now.
Yeah.
And there's been a few studies, interestingly, one in France, where they looked at where clusters of cases had happened, and they actually followed the contacts of a little 9-year-old who went to, wait for it, 3 schools and a ski class while they had symptoms of COVID.
Right.
And no one that was directly connected with that child became ill or tested positive. Crazy.
Wow.
People would say that if that were an adult, that a lot of people would have been positive. In Australia, there's a researcher working on this right now, and she's looking at when homes and families become infected, is it a child who seems to be the first point of contact? And we don't have that work published yet, but the preliminary data suggests that it's rarely a child who seems to start the infective process. Mm-hmm. Now, you and I both know that there's possibly lots of reasons for that. In other words, adults go a lot more places and often touch a lot more stuff and interact with a lot more people. But kids, of course, interact with each other. So the whole world is trying to figure out if little ones, our school-age kids, are what we call a vector, the thing that moves the droplet or the infection from one person to another. We do know that for regular flu, you know, the seasonal influenza, like proper influenza, not just
we're going to talk about that a little later.
Yeah. For regular influenza, kids are identified as the first kind of the source of the first identified case about half the time.
Really?
Yeah.
So now the docs are trying to figure out, why is there a difference between the two?
Exactly. And it's probably related to the properties of the virus. One of the things we need to know is, do kids who are not symptomatic shed virus and transmit? And I don't have an answer for that. Brand new virus. The entire world is researching these questions, so parents aren't alone in their questions.
So is a good course of action always to say err on the side of caution right now and just believe at this point in time that yes, they are, but don't like really kind of make it too big? Is that reasonable?
Yeah, I think there's a big difference between caution and anxiety.
Great comment. Yeah.
Right? It's about being smart and looking out for our fellow person rather than being terrified and afraid and not sleeping.
Another question I have, because we kind of concentrated on little ones there, but let's go with the older teens and adults who are sexually active with one another. Is there a risk there as well when it comes to healthy human sexuality?
Yeah, it's a great question. And we know, for example, you can't, this is going to sound like a funny parallel, but you can't catch COVID from COVID on your broccoli.
Right.
Other body fluids, I don't know the extent of research on other body fluids, but here's the problem, is saliva. So for teens who are dating and swap and spit, COVID lives in your saliva and droplets, so that it's face transmission that usually gets you sick. So you touch a droplet in your store, it was positive for COVID because someone just coughed or sneezed. And then what do we all do? I'm not going to do it, but we touch our eyes, our nose, or our mouth, and then it gets into our respiratory tract. So yes, everybody should still use precautions, but likely the problem is in our saliva.
Gotcha. Next question I have for you, Doc. Are you concerned, given that the fall flu season is approaching, that this could compound concerns surrounding COVID? And what can families do? You know, what's going to be interesting to me anecdotally is, you know, because we're taking all these precautions for the past, year, maybe the flu season this year ain't going to be as bad as it used to be. But, is there, I know. But is there a risk of compounding, or what I call compounding factors here?
That's a great question. Thankfully, Australia, who's a little ahead of us.
Those bloody Aussies.
Those Aussies.
Yeah.
They're in their winter.
Yeah.
So their seasonal flu, it's fascinating, but their seasonal flu numbers are down. I'm hoping they stay that way. And we suspect that it's because everybody's self-isolating, washing their hands, wearing masks, and not sharing the flu. Boy, we hope that happens in Canada. We'll know in September when our flu season usually starts. So it is unusual for people to get two illnesses at the same time.
Oh.
It is unusual. Now, is it possible that someone who was sick with influenza, who's been very, very ill, and can I just talk about influenza for a second?
Absolutely.
Because the flu is probably the most maligned term in the world. We all say we had the flu when we had a vomiting illness. We didn't. We all say we had the flu when we had a cold and we felt crummy and, had to blow our nose for a week.
Yeah.
Influenza is a viral illness, influenza A or B or H1N1, pick your flu, that is debilitating. It takes healthy people and puts them to bed for days or sometimes weeks.
Right.
It's not having the sniffles and missing a day of soccer practice.
Right.
True influenza is a life-altering disease, and you hear people talk about that. So if you have just suffered a terrible case of influenza and you were laid up for 10 days and you're feeling run down and exhausted, you could be in that immunocompromised state and then more likely to be afflicted by COVID. Do we have data on that? Not a shred, because this is new for us. We're just entering our first flu season. So the answer is, I don't know, but the more we do to avert the flu, the better. So socially distancing, hand washing, and so on, and getting your flu shot.
That was going to be my question. So the flu shot would be important here. Now, what about these people who are saying, well, the flu and COVID are the same thing?
Oh, So there's lots of conversation about that. People say, oh, it's just the flu, and we don't worry about the flu. The flu kills hundreds of thousands of people a year. But we have an immunization for most strains of the flu to either limit its spread, very important, or to limit the course of the disease for some people because you have some immune. And we look at predictions. I don't. The public health officers look at predictions of what the flu strains were and try to target vaccines to cover the 80% of the population. So it's true, influenza is a significant disease. The difference here is this is a disease process that we don't understand, that has initially a very high mortality or death rate. And now that we've learned some of the side effects of having it, so we can manage those better, we're getting that rate to come down. But because it's brand new, we don't have as much of an understanding of the medium and long-term effects. So it's easy to say it's just like the flu, but we haven't seen the downside yet.
Gotcha.
So influenza, if you survive your influenza, which thankfully many people do, we know that there are not long-lasting cardiac effects. There's not lung destruction, except in very specific populations. We're starting to learn a lot more about this illness and its longer-term effects. And we've only been doing it since the spring, late fall last year. Right.
Excellent. Next question I have for you. This one makes me laugh, to be quite honest, but it's not funny, right? When you dig a little deeper, because it's spreading like wildfire. Like, Do masks really help? And what about some of the beliefs out there that they affect oxygen levels, or the belief that you're just rebreathing germs and because of that can cause lung infections? Like the amount of I think it's disinformation, but we'll hear from you in a second as the medical person. But I mean, the amount of disinformation specifically on the topic of masks right now, and that, people are saying don't wear them for this reasons. I'd like to hear from you. I mean, you're a doc. I mean, you guys wear masks all the time, right? So I love it. So let's hear from you.
So this is a great question to ask, because the very, very, very short story is, unless you have a debilitating lung condition for which you are very likely on home oxygen, a mask or a mask.
Well, that's a good one.
Has no effect, zero effect on your oxygen levels in your blood.
No.
None, zero. And no effect on the carbon dioxide levels in your blood. So I'll just explain that for a second. So, and I'll just draw a parallel that everyone can understand. So when I work in the emergency department this coming weekend, I will wear this for 9 hours straight. I will not succumb to low oxygen levels. I will not be drowsy from high carbon dioxide levels. And my friend, the respirologist, will not have to resuscitate me. This is a garden variety surgical mask that every hospital employee is familiar with. Similarly, or in the same vein, a cloth mask like this fetching little number that I have is 2 strips of cloth with the possibility of putting a filter in between. Again, no effect on oxygen levels, zero, and no effect on carbon dioxide levels. In other words, decreasing your ability to blow out carbon dioxide. When I wear a mask, it's to protect you. You wear a mask, it's to protect me. And so the thing to know is that the mask gives the wearer some benefit. There's no question that some droplets are captured on a mask if someone sneezes in your face. But really what it does, why do surgeons wear masks? It's to protect the patient who's having the surgery from the surgeon breathing into their open area. So that's a thing to know. And then you asked about something else about wearing masks.
Yeah, causing lung infections, which is another thing that is just like, it's unbelievable. As you know, I do online investigations and stuff. And one of the things I've been doing is really looking hard at a lot of the disinformation information that's going on there, as well as hate crime and some other things that are happening online right now. But the amount, this one is really catching steam, right? With respect to, these masks, if you wear them for any length of time, is going to cause lung infections.
Yeah, so that's not true. And the reason it's not is the mask is protecting the person across from you from your already breathed out stuff. Mm-hmm. It's already in you. Mm-hmm. And because it does not interfere with ventilation, the ability to move air in and out of the lungs, it's not decreasing our normal respiratory function and our lungs' normal ability to clean themselves. It's not like a bacteria that's sitting there smoldering on the surface and breeding on the surface of your mask. You're in contact with the inside of your mask. And what's coming into the mask is that which you already have. You're protecting the other person. That's
really good explanation.
You should be upset with them not wearing a mask to protect you, unless there's a very specific reason why they shouldn't. And I just want to talk a little bit about wee ones.
Yeah.
So little ones under 2, and then a couple things about masks. So little ones 2 and under are not capable for the most part of wearing a mask. And they're messing with it all the time. It's in their mouth more than it's out. It's in this position. It's in this position. And this strap in a small one, and they're very creative, You can't get it over your head, but I bet your 2-year-old can get it over their head.
Yeah.
In little teeny babies and in kids under 2, we generally say no mask because they can harm themselves with it by accident. It's got nothing to do with respiratory function. The other thing about masks is having a mask on plus washing your hands is the dynamic duo. If you're wearing a mask and you're touching it all the time, I love this position that people like to wear it in, or this position, the odds that anything on the outside is coming onto your face is high. So when I put my mask on, I leave it on. And when I take it off, I put it on a surface. Well, if I'm in the hospital, I discard it and get a new one. I don't wear it around like this, although it is a thing. And so the idea is put it on, go do your stuff, take it off. And if it's a cloth mask, like my little daisy mask, wash it, get a new one for your next trip. And that way you're not handling, a wet, yucky mask.
Right. Excellent. Awesome. Next question. I knew I got the right person. I just knew it. Next question I have for you, Doc. How is the COVID virus transmitted? Is it transmitted through touch, aerosol, both? Like, what's going on here?
Oh, yeah. So this is a great question, and it comes up all the time. And thankfully, we have evolving research that helps us. So respiratory diseases, so diseases that grab on us by us inhaling or ingesting the particles and they find our lungs, they're spread when liquid droplets come out of your mouth when you cough or sneeze or sing or yell or talk. It's important to know that the viral particles don't have wings or legs. They don't jump. They don't fly. They need a vehicle to carry them, and they travel in little droplets. And usually, if we have a good big cough or sneeze, those droplets will land up to a couple of meters away.
Right.
You know how some people are loud sneezers?
Yeah.
Like those droplets are going somewhere. And so they can land on a person across from you or near you within 6 feet, or they can land on a surface. And then you touch that surface and your face, and there you go. So lots and lots of research has been done on, do the droplets stay suspended in the air? That's what an aerosol means. So do the droplets hang there? And so lots and lots of hospital work has been done, and droplet spread studies have been done. And right now, there's not convincing scientific evidence that the droplets hang suspended in the air, except for a couple of very specific times. And that's the times that happens are in hospitals. And that's when we're doing something called an aerosol generating procedure. So a good example of that is if someone's sick with a pneumonia or COVID, for example, and we need to look down the lungs with a camera called a bronchoscopy, where we're running high flow oxygen and suction and stirring stuff up, then that's an aerosol generating procedure. And those droplets, because they've been fractured and made very, very tiny, can stay suspended in the air for a while. So in the hospital, if we're doing something like that, we have many, many layers of protection. And we ideally conduct that procedure in what's called a negative pressure room that takes the air out of the room and runs it through a filter. So for the average person who's just around in the community or at school, the answer is we know for sure that it's droplet spread. The way you can stop sharing your droplets is to wear a mask. The way you can stop from getting droplets is in part by a mask, but mostly by washing those paws. And those two things together. So If you can't be far enough from people, you should be wearing a mask to protect them and they protect you. And we should hand wash, hand wash, hand wash.
Because those droplets, am I correct then that those droplets, like if they say hit a desk as an example, if all of a sudden I sit in a desk with somebody who had COVID and I put my hands on the desk, then there's a transfer to my hand. And as you say, a lot of people will now rub their eyes, rub their nose, rub their mouth, and that's how the transmission takes place?
That's right. Or I think one of the things people worry about is, oh, I walked past a runner.
Yeah, I've heard that one a lot as well.
And so I usually say, here's the thing, be kind to each other. Yeah. If there's a 14-year-old boy going for a run because he really just needs to get out of the house, not yell at him for not wearing a mask. Sure, it'd be ideal if he wore a mask, but give people a wide berth, step away from each other, don't freak out. And outdoors, there's wind blowing and droplets are less likely to come your way. And you can always turn your face away. Your mask provides some protection. One more thing, N95 masks, commercially available N95 masks, they filter droplets from coming to you. But that's what I would wear if I'm doing an aerosol generated medical procedure, plus a shield. Gotcha. When I'm patients face-to-face in the emergency department, I just have a standard issue mask.
Excellent. Next question. If someone in our family has been exposed to COVID, what is the risk to the family and how can we mitigate that risk? What do you think?
So mitigate's a big word.
I know. Don't ask me to spell it, though. Don't ask me to spell it.
We could translate it into lessen. So let's say someone has had symptoms and they've gotten a test and it's come up positive. So what we usually would recommend, and we have to factor in what is possible. So you don't send them to the garage with their blanket and pillow. If your home allows...
Beth, did you just hear that? That's my wife, as you know.
There you go. If your home allows it and the person is old enough or young enough to manage it, to have them in their own bedroom is ideal. Not everybody has space to do that.
Right.
Let's face it. And if grandma lives with you and she's COVID positive, she may not be able to manage being in her own bedroom off in a different part of the house. So reality sets in. The person should be wearing a mask if possible. And again, some elder people, little ones, can't wear a mask. And then people around, we avoid very close contact. We avoid kissing on the face or head. We try to be 6 feet away from individuals as long as that's possible, and diligent hand washing. So it's important that the person still receive care. Adults generally will go to a separate space in the house, avoid sharing meals together, sharing cups and utensils, kissing on the face or head, and just avoid close contact and good hand wash.
What about latex gloves in the house? Like if all of a sudden you're having to go into, would wearing of a latex glove help to mitigate that risk? Or I use that word again, mitigate.
The problem with gloves is people assign them superpowers.
I love it.
What we see is people with latex gloves who pick up their water bottle, scratch their face, adjust their mask, put their hat back on. I actually watched that happen in a grocery store lineup. And the glove has been everywhere.
Yeah.
So in healthcare, what we do is we wash our hands. We put on our latex gloves to go and render care so that we don't put germs on our skin. Then we remove the gloves in the room and we wash our hands again immediately after single use. Yeah. We don't fix our mask, push up our glasses. That's the hardest thing. Or fix our hair while we're wearing the gloves. But have a look around in the community. People who are wearing gloves in the grocery store are handling everything because their super gloves are working.
You know, I'm not gonna lie to you. I use them only when I'm doing filling up my gas, right? But I'm very careful about putting them on to not touching, and when I'm done, take it off properly and put it in the garbage, right?
and you would be equally protected. Hand wash or hand sand before, fill your gas tank, hand sand right after.
Perfect. Next question I have for you. What is a realistic outlook for the COVID vaccine, and why is it taking so long? Like, like people are just going like, what's going on here? Why is it taking so long?
It's a great question. So probably since the Spanish flu epidemic, I would hazard a very uneducated guess that never have so many people at the same time looked for a vaccine for the same illness.
Yeah.
This is a terrible illness on our population in the world. So a very large number of companies and researchers are looking for a vaccine. So what the heck's taken so long? The first thing we have to have is a virus that we can identify its pedigree. So the virus, it's called coronavirus because it looks like the sun. So it's a little round ball with a bunch of golf tees sticking out of it. That's the way I think about it. Mm-hmm. Each one of those golf tees may or may not be the same protein. And that's how the little devil grabs onto you. And so what scientists, and that is not me, it's not the work I do, what they do is they find the virus, they identify the size, shape, and character of the protein so we can target a vaccine to grab up that protein, jump onto that golf ball, and kill it. And it's to signal our immune system, hey, it's over here. That's how I think. So the first thing is we need a virus that's identifiable. Check, we have that. We have to understand the proteins, what they look like and how they behave. We understand that. And the virus mutates, which means it changes those proteins. And we know that there are several kinds of those proteins now. So the people that study viruses have figured that out.
So we have several strains of COVID then?
There's several. I know of a couple of strains.
Yeah.
And the virology people are working to see, is it stable enough that we could identify the proteins reliably and then target a vaccine to it.
Gotcha.
Okay, sidebar. Why don't we have a vaccine for the common cold? Because it's a coronavirus, but every year it's different. Gotcha. And within each year, it has different makeup. So there's no vaccine because there's no stable structure for it.
Gotcha.
So with coronavirus, the researchers have figured out the protein structure. They have figured out the strains, and they're working on the vaccine to grab onto that thing, signal our own body's immune system to go get them. So what takes so long? You have to first, in a dish, make sure the vaccine will attach to the virus. Done. The next stages are finding out how much of a dose you need in different kinds of experiments. And then you have to make sure it's not going to do harm to the human who gets it. And then you have to see if it works across a broad population. All of that takes time, effort, and ever careful escalation to the next step. So we've heard that Russia is very close to a vaccine, and people say, why isn't Canada closer? The way our society works is we only vaccinate volunteers with new vaccines. In Russia, they have access to a large military who become subjects. And so it seems escalated by going there. So we're close, but we want something that's effective and safe.
What's the danger? Like, because we hear phase 1, phase 2, phase 3, and it looks like a lot of them moved into phase 3. But there's some discussion right now in other countries saying, well, phase 2 was pretty good, so why not just do it? What's the danger of moving to a vaccine too soon without fully testing it?
The biggest danger is that you think something works when it doesn't. So that's the biggest danger, is it seems to work in a small cohort. But there's something.
And cohort, for people who don't know what cohort mean, what does that?
Group.
Okay,
Group.
yeah.
So it works in a small, carefully chosen group. but that effectiveness doesn't translate into the whole population. So normal healthy volunteers, for example, don't represent always the normal population. So the worst thing in medicine is to think something works when it doesn't.
Is Canada well positioned that when a vaccine has been identified that has a high percentage, because I don't think we'll ever have anything that's 100% effective, right? But are we well positioned as a country to roll this out quickly so that we can get our population immunized? Like, what makes us different than, say, other countries?
Oh, yeah. So first, Canada has leading researchers that are involved in the work, and that's ever helpful. We also have universal access to healthcare. And, it's a pretty bad thing when you can't afford to be immunized, so you're not. Yes, we know the flu shot and other things have some charge associated with them sometimes. So I think the basic access in Canada is not problematic. We have a small population compared to the rest of the world.
Right.
So we can actually reach a large number of our citizens quite easily. I mean, we fit in the pocket of a lot of countries, and just the lack of cost and universal access, and also interest. Canadians care about other Canadians, so uptake will be good.
And just this kind of blends nicely. I'm gonna forget the next question. I'll ask the last question, but this kind of segues nicely into, it seems like we've kind of done a really good job. Like I was talking to you off camera about the fact that, testing, we can get results here in British Columbia back within a day, you told me, right? Like, can you just build upon like what we've done in this province? Like when you shared that with me, I went, we need to get that information more out there, because I don't think a lot of people know exactly what you as a medical community have done holistically to deal with this, right? So maybe you can share that, because I think that'll help reduce some of the anxiety. Because, you watch the news and, because most of it's US based, they can't get tests for 7 days or a week and stuff. So what's it like here?
Yeah. So here's a great thing. And boy, I wish I could take credit for this, but as we all know, Bonnie Henry, and yes, I own the t-shirt. So here's the thing. In Canada, we took this very seriously right off the bat. And in British Columbia, categorically, it was taken seriously the minute we knew about it. And Dr. Henry and her team of experts across the province of medical health officers acted quickly, definitively, which means with great decision, and recognized the need to protect our population from this virus. One of the things that Dr. Henry did was immediately restrict travel, which was a little bit soul destroying the week before spring break, right? Where all you couldn't go on your very long awaited and much needed holiday. And her point was, let's not go get this virus. Let's be ready until it comes to us. And of course it came to us because the entire world didn't shut down and some people had already traveled and so on. So enter the next stage, which was tracing the disease pattern very diligently. And our medical health officers and their teams, every single positive test is immediately followed up to every contact and every household member and their contacts, all of them.
Like, wow.
And that takes a remarkable amount of human effort. And if you've gone to a shop or a restaurant or any kind of public place lately, you probably have had to leave your contact information. And that's in case someone who works there turns out to have the illness, they can find you and follow you. Not in the bushes, but,
Right.
So the other thing that we worked very hard on provincially is testing. And what our provincial health officer and the medical health officers around the province did was to immediately mobilize with our laboratories across the province to say, we need to do our own testing. We need to get reliable, effective, timely testing up and running. And everyone who has symptoms, who meets the criteria to be tested, will be tested. And that happened. You'll watch some American news channels and realize that that is not happening. So about the testing. So for the island, what is fantastic is in the early days, back in, say, March and April, we had our labs gearing up, and it's a very specific test that requires expertise to do. You want to do it right. You can have it, right is good. So what happened was we would run tests twice a day, and if the need arose, 3 times a day. We now run tests 24/7.
And is it the nasal swab?
It is still the nasal swab. The world is working on the spit test, which would be endlessly more comfortable. But right now, it's the nasal swab. I'm wrinkling my nose, but I have a delay, so I can't see it. And then the nasal swab is processed in a very specific way, and it's a very specific swab. Who knew? So it's not a Q-tip on a red cap. It's a very specific swab that picks up virus, but also lets it go when it's placed on the little plate that they grow viruses on. Who knew? It's not just a Q-tip. So you can eat yourself. And then what's happening now for Vancouver Island is the tests are run as soon as the test grouping is full, it's processed.
Wow.
There's some delay currently in getting access to a test, which I think we'll talk about. But once your test is in the hopper, you're going to get results within about 18 hours and very likely faster than that.
Wow.
We don't call people at night, but we do run tests at night. So if it's very late in the day when you get your swab, you're probably going to wake up in the morning, call the number you were given to get your results, and have your results the next day. If it was done early in the morning today, you'll probably have your results that
So in the hospital, if somebody comes to the emergency and they are showing you signs of COVID, do you do a swab?
It depending on the circumstance, yes. So whether I'm discharging that person, or certainly if they need to be admitted for some reason, they get a swab. And depending on the time of day, I'll have the results the same day.
And you just mentioned the delay, a little bit of a delay that's going on. What's going on there? And there's plans to overcome that, right?
Yeah, that's right. So back in March and April, when the world presence of COVID was high and we had quite a few cases on the island, we had a large number of phone lines, like 1,000, all at one.
Oh, wow.
And very, very many staff members and the people who man the phone lines have medical training because there are very often medical questions that come up. And so there were lots of testing centers across the island and many centers in Greater Victoria. And we were taking calls and processing, and people were being swabbed in their cars and so on. Well, when the disease likelihood or the prevalence, the number of cases in our community went down, that's an expensive set of things to run. Staff have other jobs. So people returned to their usual jobs, and we decreased the number of phone lines because each phone line requires a number of people to man it, and the number of swab centers. Of course, we are watching this disease like a hawk.
Yeah.
And as it goes up, and we are already ramping up the numbers of phone lines and the numbers of testing centers. So right this minute, because disease prevalence or the number of cases in the population is quite low, we are just in the process of ramping up those phone lines. So people will express lots of frustration about trying to get through. And a couple of little hints. First of all, a couple of days ago, there were so many calls, the whole thing crashed.
Oh.
So the poor phone people had to get that. A very large number of calls come first thing in the morning, 8 a.m. The thing lights up. So if you can hold your question until an hour or two or early afternoon, then that helps. The other thing is people are calling arrange a test line to find out if they need a test. And there are other ways to find that out. So all you have to do is Google, as my dad says, the Google. If you Google COVID self-assessment BC, or go to the BC CDC, sorry, my computer just went to sleep, and just say, type in, do I need a test, or follow the link for that, then it will allow you to evaluate or to study yourself or a family member to see if you qualify to have a test.
Great.
Then you call the number to arrange for getting that test.
Great recommendations, Doc. Only two more questions.
No problem.
Next question I have for you is, where are some reputable resources parents can turn to for information? Again, the amount of disinformation that's out there, it's just astronomical. So, I mean, you mentioned one, the BC CDC. I said it. Don't ask me to say it 20 times fast. But what are some other ones out there that you recommend that are reputable and can be trusted by parents?
Right. So the online, the BC CDC is probably your best source. It's user friendly. It's kept up to date. It has tabs for frequently asked questions, questions around kids, questions around elderly people, what to do when, and so on. Locally in Greater Victoria, you can call 811. Those are very busy, but you're speaking with a registered nurse. All of our 811 nurses are very well trained in COVID screening and in providing advice. And don't forget your trusty family doctor, who is very well versed in these issues, or your nurse practitioner, who can guide you through a lot of your questions, particularly for people who have illnesses or conditions that require ongoing treatment. Your family doctor and your nurse practitioner are wonderful sources of information. There is a ton of work and availability in telemedicine now. So you don't have to go to your family doctor's office. They can meet you virtually. And for those who are not computer savvy, the phone still works.
Yeah. But even the online consulting, it's so easy now. Like they've met it. That almost anybody can do it. Like I've used it with my family doc, who's been great, right? Like it's just amazing, right?
And then the other caution I would say is don't read too much. Don't have CNN on loop on your television, because your little ones are listening too, and they hear all the stridentness. And, it's okay to gain information, just don't drown in it, and you'll find your favorite source. And it's okay, as long as it's frequently updated, to use that source.
I like Dr. Gupta on CNN. Like when he talks, I kind of listen to him. So last question I have for you, Doc, is what do you recommend are the top 3 things parents should be talking to their kids about for those who will be going to school, which is going to be starting up in the next couple of weeks? I mean, a good example, one of the things that I posted recently is, a lot of the kids have their cell phones, and, prior to COVID, pre-COVID, they would love to share their phones with one another. So one of the things I said to parents is, talk to your kids about, we don't want to be doing that anymore. But from a medical standpoint, what are the top 3 that you would like to share with parents?
I would say for our parents, your kids are watching you, and lead by example. If you are anxious and afraid and talking about doom and gloom all the time, your kids are going to pick that up.
Yeah.
And look to you for that, that moral rudder and that stability. Lots of people are anxious. Try to talk about that with grown-ups. And remember those little, how it is, just swear once and they're saying it to everybody in the supermarket. So they're picking up your vibe. That's, can I have 4 things?
Oh, absolutely. You can add as many as you want. I just don't want to take up too much of your time, because I know how busy you are, and we've gone a little over. So
you're right, because I do have an.
I know. We're just about done.
The second thing is stay home if you're sick. Don't share the wealth. And parents set the example. If you're sick and you need to stay home from work, that's important. Kids should be staying home if they're sick. Boy, is that an easy thing to say and a hard thing to do, right? The third bundle is masks and hand washing. So practice makes perfect. We all touch our faces all the time, but let your kiddos wear their mask when, to get familiar with it. Sitting and watching TV while you're watching a great movie and wearing your mask,
Great
it makes
idea.
you much more comfortable with it.
Yeah.
And practicing hand washing and singing happy birthday.
Yeah.
And the last thing is, it's okay not to be okay.
Yeah.
So
true.
kids are afraid. They're listening to what people are saying. They hear people in hallways. They know little kids. My nephew, who's 10, said to me the other day, I don't want my dad to get this because he'll die. Yeah. And so we had a short conversation about the fact that Canadian healthcare is fantastic, that doctors and nurses are still caring for people with COVID. And, oh, by the way, all other illnesses, don't stay home if you're ill with something severe.
Like chest pains. Yeah.
Exactly. But it's okay to talk to kids about the fear and how to rationalize and manage fear.
Yeah. Great points. You know what, Doc? I'm going to let you go now because I know that you have another important appointment, but I can't thank you enough for joining us today. I mean, just the way that you approach this in a very open, honest, humanistic, understandable way, I think will help to decrease some of the anxiety that a lot of parents have been, voicing to me and stuff. And I think something like this will go a long way. So I really want to thank you for coming in today. So I'm going to let you go unless you wanted to stick around for another minute because I'm just about to end. So thanks, Doc.
Thanks, and see me try not to touch my face.
I saw that. So everybody who's watching, you can see once again why I brought in such an expert. I've known Dr. Hall for many, many years now. And what I just love about her is just her bedside manner. She's just awesome, right? And taking the complicated and dumbing it down so that people like me can understand it. That's what I love about her. And just the way that she approached this topic, right? Like, I'm very much, and when it comes to doing what I do in social media, evidence-based, right? Let's make decisions on the best evidence, best science possible, best research possible. And that's what I love about Dr. Hall as well. So on behalf of myself, Dr. Hall, who just finished, as well as Brandon, who's doing the most important job working behind the scenes, I want to thank everybody for attending today's Thinkable Thursday, and we'll see you next time.